Dr. Kahng, let's talk about dental hygiene, the brushing, the flossing. Tell us what type of brushes people should use. There's still so many people. When I grew up, flossing was done like this. Then it became like this. Now it's kind of like round and about, and even that changes. Not everybody does it the same way. Some people say you hold the brush 90 degrees to the teeth. Some say you hold it 45 degrees to the teeth upward towards your gum. Tell us about hot brush, soft brush. Tell us about the difference between a normal brush and the currently new electrical brush. I mean, every electrical brush advertiser says his one is just, basically doing a good and a better job. Tell us a little bit your opinion from a dentist. You must have seen it all.
Okay. For the toothbrush, personally, I like to use just a manual regular toothbrush. The reason is, number one, it's much cheaper. And number two, you can control by yourself brushing your teeth. But the electric brush, the big advantage is motivation. Some people, they don't like to brush. But when they get the electric toothbrush, they brush very well. And another thing is some handicapped people, they cannot brush well. Also, electric toothbrush, it helps a lot.
Okay.
Toothbrush, there are many different kinds of toothbrush. Big, small, or hard, or soft. Usually I suggest use the soft toothbrush and the compact size. It can brush better and easy to control.
Okay. Wonderful. So, anything you have to say on, on toothpaste? So there anything which are better than others, or what's the deal there?
Usually the toothpaste, if you go to the market, there are many different toothpaste, but making sure the toothpaste has to have the fluoride. It prevents cavities dramatically. So when you buy the toothpaste, you can buy some major brand and with the fluoride, you're not going to make any mistake with it.
Got it. All right. So it's a matter of flavor, I guess, right?
That's right.
All right. Now, what about flossing? Anything you have to say there? Is there something we people have a tendency of doing wrong often, constantly, always? Or not?
Flossing is the people, okay, actually when I see the patient, I always ask, do you floss your teeth? Then actually more than 50% they say they don't floss. So flossing is a big issue. Because when you brush your teeth, very regularly brushing your teeth, but still, if you don't floss your teeth, then you clean only about 50% of your teeth, because in between your teeth, then the toothbrush cannot reach there. Floss is the only way you can clean in between your teeth. So you have to floss your teeth after brushing your teeth. Then it's gonna prevent the gum disease or cavities a lot.
Okay, all right. And so when you floss, should you be paying attention to, let me tell you what I do and feel like, and whether that is actually the right thing to do it. I think that a big part of flossing is, to pressing it not too hard, but nevertheless against the gum upwards and kind of go like this to clean out because that's where I thought is the gum disease. And I very much simply kind of don't want to get gum disease based on, what you said in the other video and what I asked you about all the kidney failures and all that. So, and basically massaging the gum a little bit. But I have heard that that's not really what you should do. Give me your viewpoint on it.
Okay. When you floss your teeth, flossing, the primary purpose is you clean the plaque in between your teeth. Okay. So when you floss your teeth, you can gently rub against the root in between your teeth, and then you can pull it up, and then you can do the other side too. You can loosen up the plaque, and you can rinse out, so you can remove all the plaque in between your teeth. That's what I can do. And there are a few different kinds of floss, but I recommend to use the waxed dental floss because it's easy to use and pretty effective to clean the plaque.
Okay, all right. So is massaging the gums an okay thing or not such an okay thing?
Massaging the gum is a good thing to clean, make it a healthy gum. Yes,
so massaging them a little bit is a good thing?
Yes.
Okay, so I'm on the right track, but I have heard that might
That's
be
right.
too much aggravating them. Anyway, good. Now, well, another thing on that dental hygiene. About 15 years ago, I lived for a couple of years in India, in Bombay, and everybody I knew there was using a tongue scraper. So I started using one too. Never did before. And it felt pretty good. I now don't use one anymore because I don't know, just never went around it. But I use my brush. So I brush my gum and my tongue and my gum. Frankly, I usually choke a little bit on it, but I'll do it. Well, what's your take on that?
For the tongue, if you look at the tongue, it has lots of taste bud, and usually the food stuck in between the taste bud, and it causes lots of the bacteria attract over there. So the tongue has to be cleaned, and the people they using the brush to clean the tongue, but more effective way is using the tongue scraper or tongue blade. It can clean up the tongue more effectively. Brushing your tongue is also a good idea, but it's not as effective as like the tongue blade or tongue scraper.
Okay. So I should go back and get one.
Yeah, that's right.
And most pharmacists, most dentists will sell it, or what?
Yeah, you can go to any pharmacist or any market, or your dentist, they can easily get it.
All right. Okay, but it is overall, you should at least brush it, but ideally even better use a tongue scraper. So you think a tongue scraper is better?
Yes, definitely, yes.
All right. Well, it's a very long-lived civilization in India, and so very obviously they do, with no doubt, something right. I loved it very much being there anyway. Thank you very much, Dr. Kahng.
Thank you very much.